Assalamualaikum warahmatullahi wabarakatuh. So we are from group 6 and today we are going to present about the HIV and AIDS outbreak. So this is our group members consists of Syaza, Yasmin, Ainatul and also Alya. So these are some contents that we are going to present related to the HIV and AIDS outbreak, which is background of the outbreak, epidemiological profile, outbreak data and pattern, public health response, link to prevention levels, and also some conclusion.
Assalamualaikum warahmatullahi wabarakatuh. My name is Yasmin Binti Muhammad Razid and my metric number is 2414966. Today, I will be presenting about acquired immunodeficiency syndrome or AIDS, a disease that caused by the human immunodeficiency virus, commonly known as HIV. The first outbreak of AIDS was officially detected in Los Angeles, United States, back in 1981, but the virus itself actually originated much earlier, around the early 90s, in Kinshasa, Democratic Republic of Congo. Next, the origin of HIV can be traced to Central Africa near Kinshasa, where it is believed that the virus was transmitted from chimpanzees to humans, and the process is called as zoonosis or cross-species infection. Although the virus had existed earlier, it was not until 1981 that AIDS was first recognized as a serious medical issue. That year, the CDC reported 5 young men in Los Angeles suffering from a rare pneumonia known as pneumocystis jirovecii pneumonia, a disease typically seen only in people with weak immune systems. This led to the formal identification of AIDS. So, while Africa is where the virus began, the outbreak was now. Let's look at the timeline of the outbreak. In the 1980s, AIDS was officially recognized as a new disease and HIV was identified as the causative virus. The first blood test and antiretroviral drug AZT were developed. The WHO also launched World AIDS Day in 1988. Moving into the 1990s, the global number of HIV positive individuals past 10 million, and a new treatment like protease inhibitors were introduced. Clinical trials for AIDS vaccines was begun. In the 2000s, HIV became the leading cause of death for adults aged from 15 to 59 globally. Over 40 million people were living with HIV and treatment improved with once daily pill like Atripla. Also, the first known case of a functional cure in the Berlin patient and experimental vaccines show promising reduction in infection rates. So, how it was detected? The outbreak was first detected in June 1981 when doctors in Los Angeles saw a cluster of healthy young men presenting with a rare type of pneumonia called pneumocystis jirovecii, which typically only affects immunocompromised patients. Around the same time, Kaposi sarcoma, a rare skin cancer, began appearing in similar patients. The CDC documented these unusual cases in its Morbidity and Mortality Weekly Report (MMWR), raising national awareness. Because many of the early patients were homosexual men, the disease was initially labeled as GRID, or called as gay-related immune deficiency. But as more diverse groups were affected, it was renamed as AIDS, and by 1983, HIV was officially identified as the virus behind it. Next, HIV is a lentivirus from the Retroviridae family. It targets CD4 T cells and weakens the immune system. There are two types, HIV-1 and HIV-2. It spread through unprotected sexual contact, blood transfusion or shared needles, and from mother to child during pregnancy or breastfeeding. The incubation period is about 1 to 6 weeks with initial symptoms, while the contagious period can last over 10 years without treatment. Initially, it affected young homosexual men in the US, but later spread to heterosexual hemophiliacs, infants, and healthcare workers. In sub-Saharan Africa, it became an epidemic mainly through heterosexual transmission.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ainatul Mardiah and my matric number is 2413312. Now, I will continue about the outbreak data and patterns of HIV cases. So, based on the article Current Approaches to HIV Prevention, Treatment and Care by David Thomas Evans and Mark Dukes, number of cases in UK were estimated to be 101,200 people, and about 13% of them were unaware of their HIV status. Meanwhile, global data estimated 36.7 million people living with HIV and around 30% were undiagnosed. And since start of pandemic, number of deaths for global record is approximately 39 million. Based on this article also, there is a significant reduction in a new HIV infection in the UK between 2015 and 2016. It is most apparent in gay, bisexual, and other men who have sex with men. Now, let's move on to the transmission patterns of HIV. For this section, I refer to the article A Review on HIV/AIDS. The transmission pattern for in this case said to be humans to human. Each infection chain starts from someone who is already carrying the virus. Next, for the secondary transmission, HIV spreads to others through sexual contact, blood exposure, such as sharing needles or syringe, and vertical transmission, which is from mother to child during pregnancy, childbirth, or breastfeeding. Moreover, for superspreading events, the HIV or AIDS virus can spread more widely to someone with high viral load, frequent unprotected sex with multiple partners, or neither sharing in large network. Lastly, as an additional point, it is important to understand that HIV is transmitted from one person to another when there is a sufficient quality and quantity of the virus. If there is a low quality or insufficient quantity of the virus or blocked routes of transmission of HIV, the virus will not infect another person. That's all from me. Thank you.
And my name is Syaza Najwa Binti Azahar, and with metric number of 2414338. So today I will be presenting on the public health prevention effort in the HIV response. So beginning with the action taken to prevent and control the HIV. So I will start with the surveillance and screening. So surveillance systems are crucial in monitoring the spread of HIV, including the HIV antibody testing. So this testing is basically to ensure the access to the blood supplies and also establish the robust reporting and surveillance system, so that we will easy to track and respond to the outbreak effectively. So next is about the ART rollout. ART is basically the antiretroviral therapy, which is one of the major milestones in HIV prevention. So this ART rollout has made the HIV a manageable chronic disease. So they use the term of treatment as prevention. These efforts has been made globally to scale up the access to ART, especially in low and middle income countries. So next I'm going to talk about what is not applied, which is isolation and quarantine. Both isolation and quarantine are not used in HIV response because HIV cannot be spread through casual contact. So isolating people is only unnecessary and would contribute to stigma to those people that live with HIV. So similarly, travel restriction and border quarantines are also not applicable because HIV does not spread through airborne or casual transmission. So these measures are not needed and could only discriminate against individuals living with HIV. So finally, we have contact tracing through partner notification. So basically, this involves notifying the sexual or needle sharing partners. But importantly, this contact tracing is only done in a non-punitive and respectful way, often only by a trained public health worker. So this strategy has been adapted from other diseases such as TB. So it is crucial to prevent further spread. So next, I will be talking about the efforts in the HIV response. So basically, the one of the major effort is mass testing campaign. The strategies include the door-to-door testing, community and school-based testing, and also the access to self-testing kits. So this will help people to know their status and get the treatment as early as they can. So it is also important to note that there is no HIV vaccine, so the prevention only relies on the expanding the ART coverage, providing the PrEP or pre-exposure profile exists, and also the use of other prophylactic tools to reduce the transmission. So moving on to the public awareness. So public awareness can be divided into two, which is global messaging and also domestic messaging. So global messaging, the first of all, I'm going to talk about the U equal to U campaign, or undetectable equal to the untransmissible. So this campaign basically aim to reduce the stigma and to encourage the people that live with HIV to get the treatment and testing as soon as possible. So another thing is about GMAI, or Global Media AIDS Initiative. So this GMAI is basically the initiative that use the TV, radio and digital platform, platform to promote the HIV awareness. Moving on to the domestic messaging, the first campaign that I'm going to talk is about Uganda's ABC campaign. A stand for abstinence, B stand for be faithful, and C stand for use condom. So basically, this approach focuses on promoting behavior change to reduce the risk of HIV transmission. So in Italy, a national condom campaign was launched with the goal of normalizing the condom use. So the message was only simple: condoms are important part of public health and should be seen as normal and responsible. So moving on to the HIV response, that can be divided into three, which is local, national and also international. So based on the local and national, there are the surveillance system, HIV testing, contact tracing and also ART and PrEP rollout. So basically, this widespread has proven to be a game changer in controlling the epidemic of HIV or AIDS. So moving on to the international response, support, basically based on the support and funding. These efforts are often supported by the global partnership, which is UNAIDS, the United Nations Programme on HIV and AIDS, WHO, World Health Organization, Global Fund to fight AIDS, tuberculosis and malaria, and PEPFAR, basically the President's Emergency Plan for AIDS and Relief. So this contribution will provide funding, resource and technical guidance to the country that in need. So the last one is basically about the cross-border campaign, and the example is basically the GMAI, the Global Media AIDS Initiative. So HIV does not recognize border. That's why the cross-border campaigns are very essential. So their target is basically to work towards the same goals, which is the universal access to testing, treatment and prevention, especially in AIDS. I think that's all from me. Thank you. So this is basically a few of my references that I get to refer to about the public health prevention of HIV or AIDS.
Assalamualaikum and hi everyone. I am Nur Alya Binti Muhammad Syazwan Fakhzan and my matric number is 2416902. Today I'll be explaining how HIV and AIDS prevention strategies are categorized into different levels of prevention. First, primordial, primary, secondary, and tertiary. This framework helps us understanding how various efforts work together to reduce infection and improve outcomes for people living with HIV. First, primordial prevention. Primordial prevention focuses on stopping the development of risk factors in the first place, before any infection happens. In the case of HIV, this includes addressing social and environmental issues like stigma, discrimination, and sexual environments. For example, behavior change campaigns in high-risk communities, especially among older adults or rural populations in China, can reduce the likelihood of exposure by changing social norms and promoting safer choices. Primary prevention. Primary prevention aims to stop HIV infection before it occurs. This includes promoting condom use, running sexual health education programs, and distributing pre- and post-exposure prophylaxis known as PrEP and PEP. These tools are crucial in reducing transmission rates, especially in sexual active population. PPE and safe needle practices are also used in healthcare setting to protect staff from accidental exposure. Secondary prevention. Secondary prevention focuses on early detection. This includes HIV testing, contact tracing, and screening programs that identify infections as early as possible. For example, China's CRIMS system allows nationwide tracking of new cases to ensure prompt treatment. Catching infections early allows for better health outcomes and helps stop the virus from spreading to others. Tertiary prevention. Finally, tertiary prevention reduces the long-term impact of the disease. For HIV, this means long-life antiretroviral therapy or HAART. HAART. It helps people live longer, healthier lives and also make their viral load undetectable so they can't transmit the virus to others. Support systems like counseling and treatment adherence program are also essential at this stage. That's all from me. I will pass to the next presenter. Thank you.
In conclusion, HIV and AIDS not just a disease, but it is a global human challenge. While the virus originated in Africa, it was the outbreak in the US that brought it into the world's attention. But no matter where it began, the fight against HIV requires a united response. HIV is only transmitted through specific routes, which means transmission can be controlled with the right knowledge and precaution. More importantly, prevention is not just about treatment, it is about education, empathy, and public health policy that protect people. With modern treatments, people living with HIV can lead long, healthy lives by combining efforts across all levels of prevention, from education to treatment. We can continue to manage and reduce the impact of HIV and AIDS globally.